Hi everyone, Kimberly here with Dr. Mabrie.
Hey guys.
Today we have some questions from the internet for you.
Yep, sounds good. Let's do it.
All right, so this question comes from a patient who had a prior surgical rhinoplasty, and she wants to know if she's a good candidate for a non-surgical rhinoplasty.
Yeah, okay, great. The most important thing a patient can do to know if they're a good candidate after a surgical procedure is to have an in-person examination. And they want to go to their surgeon and an injector who's really experienced in non-surgical rhinoplasty, because this is an advanced technique.
Okay, and what are they looking for on examination?
There are several things I'd want to know. One, I'd want to know how much time has passed since their last surgical procedure.
Okay.
So you want to have at least 3 months. The more time the better. 6 or 9 months is even better than 3 months, but at least 3. I'd want to know how many rhinoplasties have they had. As you have more rhinoplasties, the risk of the procedure do go up.
Okay.
We'd want to look at the thickness of the skin.
Right.
So thick skin is a little safer. As the skin gets thinner, after a surgical procedure, a little more concerned about the vascular compromise and the blood flow to the skin.
Okay. Would it make a difference if a patient had an implant?
Yeah, great point. It really would. So if you've had an implant, you have a foreign body in, that's a relative contraindication or reason why we may not want to do a non-surgical rhinoplasty. Maybe we could treat the tip, but injecting over that implant, that could be concerning because you can introduce bacteria, and the bacteria, if they're close to the implant, it's harder for the body to fight off an infection.
Okay.
So that's the time where you may want to not perform a non-surgical rhinoplasty after a surgical procedure.
Okay. And is there any specific tests that you can do with the patient to kind of help them visualize what their results might look like?
Yeah, there is. A really cool thing that you can do is you can do something called a saline test, where you're taking some salt water and then you can inject that area in a similar way that you would do the fillers. And this will tell you 2 things. This will tell the patient, one, what it might look like. So you can show them, hey, as we're injecting down here, it's going to make your bridge look a little more like this. It's a little different, but it'll be similar. And the second thing is it can tell the injector how healthy is the skin. How does the skin react when you put a little bit of material underneath it? And that can give them both a little information to let them know if it's a good idea to move forward.
Okay, but a very temporary test, right?
Temporary. So you do the salt water, and that's going to last for about 5 to 20 minutes, and then it goes away.
Okay, great. Thank you.
Thanks for your questions.
Yeah.